Welcome back. Today we are going to talk about the amazing world of human organ systems. That's right. So we're going to learn about the body here on our Learning Corner with me, Dr. Nicole. I hope that today is an amazing exploration about our body and we can all learn something to take into our lifestyle that we are choosing to live greatly and widely amongst friends and family. Okay, I'll get off that. But anyways, welcome to the Learning Corner with Dr. Nicole. That's me. I am in sunny Bonita Springs, Florida, and I am alone again. So if anybody wants to come on to my podcast and have a conversation, be the narrator, or ask some questions to liven up the discussion, that is awesome, and reach out wherever you can. Social media, my personal phone number if you have that, or any other way. And if you're my brother, you are more than welcome to come and make the buzzer ring or whatever sound effects and edits that you would like to do to make my listeners enjoy this a little bit more. So anyways, let's jump right in. We are going to talk about our organ systems. A lot of times people talk about organs or cells or systems, but we're going to talk about specifically 11 organ systems of the body. Okay, let's jump in. I have so many papers in front of me. I have been doing a lot of research involving genetics and the SNPs that go along with each one of our systems, but if you really want to learn a little bit more, you're going to have to jump into my educational program because I am going to educate there and talk here. This is a podcast, not an educational system. So we are going to keep this light and fun. I'm going to bring in fun facts and tidbits so that you won't get bored during this. And I am going to watch the time today so that I can give you a wiggle break or a time to go have the potty break that you probably needed to do last time, but had to pause and never came back to listen to the rest of my podcast. Okay. Here we are. We have 11 organ systems, and then I added one at the end. So be surprised if we didn't cover what you thought we were going to cover. Maybe it is the system at the end. Boom, boom, boom. Okay. Understanding our organ systems. Organ systems are groups of organs that work together to perform specific jobs in our body. They help us breathe, digest food, move around, and so much more. Each system has a special job and it keeps us healthy and functioning. Let's start with, in my opinion, the most important system in our body. If you can think about this, what would it be? Do we need food every day? Some might argue yes. Do we need water every day? Yes, but we can go a day or two without water. How about oxygen? Ding, ding, ding. That is correct. So we're going to talk about the respiratory system. The respiratory system helps us breathe. It takes in oxygen from the air, sends it to our blood, and then carries it to all the parts of our body. It gets rid of carbon dioxide, which is a waste product. And the fun fact is, the surface area of the lungs is roughly the size of a tennis court. Holy cow, that is huge. That surface area helps us absorb lots of oxygen efficiently. So, for all my patients out there, when we talk about diaphragmatic breathing and we talk about getting oxygen through diaphragmatic breathing, that will bring the oxygen to the lowest parts of our lungs, right? So our lungs bring in oxygen. Our diaphragm pulls the lungs down if you're breathing correctly. And when we get to the bottom portions of our lungs, just a fun fact, we get the most exchange of oxygen and carbon dioxide. When you are a chest breather or have asthma and only breathe from our accessories, right, the accessory muscles, When we do that, we get less exchange of oxygen, therefore depleting our oxygen stores or possibly affecting oxygen saturation in the rest of our body. This is extremely important to understand because you can go, 4 minutes or so without oxygen. You can go about 4 days without water. I'm going to have to look up these facts. Sorry, guys. And then you can go about 40 days without food. Now, there are discrepancies. If you're healthy, those are the pushing the boundaries. If you're not healthy, you might not be able to go that long without food or water. Same thing with oxygen, but our body needs oxygen to survive. So let me look here. I have so much information. I don't want to forget anything. All right. What makes up our system for the respiratory system? I talked about the lungs, right? And removes carbon dioxide and gets oxygen. All right. Where is all this stuff? You know, sometimes too much information is really difficult to dive through. And you know all these things, but you don't want to miss anything to give it out to everybody. Let's see. Okay, we're going to keep it light. Okay, we're going to keep that to the lungs. Respiratory is the lungs, obviously. You breathe through your nose. It goes through the trachea, down into the bronchioles and the bronchioli, into the tissue of the lungs, right? We have surfactant around there. There's a whole lot of stuff going on. But the lungs is the main source of exchange for carbon dioxide. All right, moving along. What do you think is the next most important, in my opinion, and some of the literature also agrees, the next important organ system? Well, if we breathe oxygen in and carbon dioxide out, and then it enters the blood, what pumps the blood into... Right? You're going there with me? Okay, so we're going to talk about the circulatory system. It is like a highway for our blood. It carries oxygen, nutrients, hormones, other things to all parts of our body and removes waste products. The heart pumps the blood blood vessels carry it everywhere. Obviously, if you have restrictions, right? So if you have a blockage somewhere, you might get cold hands, cold feet. You might have less blood flow to the brain, have vascular dementia, right? So there's things that can happen. But when our heart pumps, it goes boom, 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 boom. In one area, out the other area, right? Oxygen in and then out to the body, carbon dioxide out, and then, breathes out. Okay, anyways, that's a whole complex system. Cardiopulmonology, I'm going to have to go back to that. But anyways, it's transferring it out into the arteries and back in to the veins, right? So we look at the transport system, the circulatory system that circulates waste products, nutrients, oxygen. That is the highway to make sure that all of our tissues actually get what they need and remove what they need. Fun fact, the heart beats about 100,000 times a day, pumping around 2,000 gallons of blood. That's like pumping enough blood to fill a small swimming pool every day. That is so much. Okay, moving along. I won't make you guess. Coming up next is the nervous system. So this is the control center, right? We got our brain, we got our spinal cord, it's our CNS, and then we have the PNS. No, not penis, sorry. I had to throw that out there. It's kind of funny. Anyways, we have the central nervous system, which is our brain and our spinal cord. Then we have the peripheral nervous system. We aren't going to talk about the ANS, the autonomic nervous system, although that is another control center. We just don't control it. It is autonomic. It's automatic. The nervous system is like the control center. It sends and moves and receives signals to and from different body parts, helping us move, helping us think, and helping us feel. It's made up of the brain, spinal cord, and nerves. So you have different doctors that look at different things, right? Neurologists tend to spend a lot of time on the nerves. Functional neurologists, chiropractically trained, that's where I lie. I look at a whole bunch of stuff going on. Why is things signaling? Are you capable of getting an adjustment? How is the response? What's your pupils doing? How is your temperature feeling on your limbs? What is the coloration? These are all controlled by the control center, obviously intermingling with a few others. So we are about 10 minutes into this podcast. I think it's time for something fun. Why don't you get up and shake it off a little bit? We can sing a song. Do you want me to sing a song? Okay. Yeah, if my daughter was here, she'd be like, "Ugh, Mom, I know you're an okay singer, but the public does not want to hear you." So maybe I'll tell a joke. I'm not good at that either. Maybe we'll just go, "Hey, we got 5 seconds. We've talked about 3 systems already, and they are amazing, and they all work together. Remember, one is not better than the other. They just all work in tandem and all have specialized skills. Therefore, we can look at them and say, how are they working together? Or how are they not working together?" All right, ding dong, back to the program at hand. Okay, looking into the 11 organ systems, function, SNPs, and fun facts. We're not going to educate on SNPs today, but I will talk about a few of them. Okay, digesting. What is the most important thing that digesting food and other things do for our body? All right, so a lot of times people come to me and they have digestive symptoms, right? So our digestive system is having a moment where it is not doing its job. It gets the bad rap for so many things. It is ultra important, but it is the thing that embarrasses us the most, right? So if you have digestive issues, you're going to be burping or farting or diarrhea or constipated or, right? All these things that other people can smell, see, taste, and hear. Now, they might not like it, but that's why I think most people come into our office with those issues. Most people who have respiratory issues, circulatory issues, and nervous system issues end up in the ER because those are like, I can't breathe, right? My limb went dead, it went numb, I got drop foot. You go to an emergency room, but the digestive symptoms and issues, people are like, I'll live, I'll just wait till it gets so bad that I'm pooping out blood, right? And then maybe they go to the ER, but a lot of times that's what shows up in chiropractic offices, functional medicine offices. I just can't digest. So let's talk about this system. What is a system meant to do? Well, it breaks down the food we eat. It breaks it into nutrients that our body can use to produce energy and to help it grow and repair. It includes organs like the mouth, stomach, and intestines. And yes, we do have different parts of the intestines. They're all the intestines, but they have different jobs, so they label them different things, like the jejunum and the ileum, the small intestine, the large intestine, the ascending colon, right? Descending colon, all these areas, because they do different things, right? Our mouth is meant to chew. Our stomach is meant to break down with stomach acid the food that is placed in it, and then it goes into the intestines where it further breaks down and then absorbs, and it absorbs in different areas for different things. The small intestine is about 22 feet long, and it's the primary site for nutrient absorption. Can you tell me what nutrient, what vitamin absorbs in the large intestine? I'll come back to that, so you think about that. Okay, let's see. It's like a long winding tunnel where food is broken down and nutrients are absorbed into the bloodstream, right? So we have the respiratory system where you breathe and you exchange oxygen and carbon dioxide. It goes into the bloodstream. You have the circulatory system, which takes the blood and pushes it around the body. It's like the highway, right? Then you have nerves, which says, we got to tighten up the vessels or loosen the vessels. We got to pump blood there, or, like have all these things going on because we need the nutrients, or we need to get the waste out, right? So all of these things are working up to then the digestive system. The digestive system is what gives the nutrients into the blood, which then gets delivered to all these nerves, right? The tissues in and around the lungs, the tissues in and around the circulatory that make up the circulatory system, right? The arteries and the veins, the nerves, the areoli or whatever they're called, the specific lung cells, right? So you have to get nutrients. Well, if that breaks down, what happens? We don't get the nutrients, right? Which then goes into our deficiency theory. So if digestion is deficient, then we might also lack in the nutrients that we need inside the blood to get to and fix and move all the other systems. See how they're kind of working together? All right, did you have time enough to think about what digests in the large intestine? If you said B12, you are correct. B12 is one of the only, I believe it's the only, fat-soluble and water-soluble vitamin. So it acts as a fat-soluble vitamin, but it excretes like a water-soluble vitamin. That's a side note here, and we can just jump into it real quick. You have fat-soluble, water-soluble. Fat-soluble gets absorbed and stays in the fat cells. Typically, you can overdose on them, like vitamin A, D, E, and K. B12 is considered one because it stores in the liver. And when it stores in the liver, it can stay there for easy accessibility because B12 is extremely important in the body. Many needs for B12. All right, so then you have water soluble, which is all the other vitamins, right? You got all your Bs. What is it? Your Bs, your C. There's no F through Z, okay? So we got B's and C's are the main, but a lot of them people don't realize. Most nutrients are absorbed in the small intestine, but in the large intestine, that's where we absorb the most of the water and the most of the vitamin B12, right? There's some nuance there, but moving along, then we look at the sixth most important, in my opinion, which is the urinary system. This filters our blood, removes waste products and extra water, so it helps with all that. And then it leaves the body as urine. So there's a lot of things that go on. When people talk about blood pressure, there's a couple things. We look at the viscosity of the blood, which is the thickness. If you don't have enough water and you're dehydrated all the time, your blood gets thicker. It's hard to move into little tiny crevices. If you have a lot of water or the appropriate amount of water, then your body has a good viscosity, and it can get into your fingers and the little nooks and crannies in your brain and down to your feet and all in the anastomoses of the body. So when we look at viscosity, we look at that area. You have the outer part of the cell and the inner part of the cell when we talk about dehydration and edema. And these fluids are typically controlled by where our kidneys are, and there's certain cells that identify, do we need to get rid of salt or keep salt, right? So that electrolyte balance. Do we need to get rid of water or keep water? Do we have waste products, right, that need to be excreted? So the kidneys go, yep, it's time. Go ahead and excrete X amount. So we can talk a little bit about edema here. When we look at people who have edema is just the swelling of water. A lot of times people will get in our ankles from sitting a long time. When you press on it, it leaves a finger indent. You know, pregnant women commonly have edema because of the pressure of the baby on the hips and then the sitting position. But edema essentially is just the fluid that's sitting around the cell and not going in the cell to keep hydration. Commonly that's electrolyte disbalance. Commonly that's immobility. Inflammation or different immune responses will pull water and keep it around the cell. There's a lot of reasons, but typically it's because there's been some sort of breakdown in the body that has allowed for the accessibility or that area to be held with water. Now, it's not super scary most of the time, but if it's only in the right leg, sometimes that can indicate that you have cardiac, what is that? Sorry, give me a moment. CHF, right? So when you look at, when you have, wow, it's going to come to me. I'm not usually dealing a lot with that in my clinic anymore, but chronic heart failure? Okay, I'm gonna have to look it up. Sorry about that, guys. My brain's like, hey, it's the end of the day and you've just been studying a lot. So anyways, when you look at just in the right leg, if the right leg's swelling all the time, that represents something different than if it's both legs or the left leg. If you do have edema, you should look at getting up and walking around every 15, 30, 45 minutes, not sitting a lot, not crossing your legs, drinking the proper amount of water, which for you, you're just going to have to explore. We're not going to talk about that today. But the urinary system helps with getting the excess waste products out through your urine, right? Uric acid, all of that stuff. And it really, really does a good job in filtering, unless you have a kidney disease or there's maybe some stress going on that needs to be addressed. The kidneys filter a lot. They filter 120 to 150 quarts of blood every day, producing about 1 to 2 quarts of urine. That's filtering enough blood to fill a large bathtub every day. So basically what that's saying is our blood goes through a system and it pumps around our body by our circulatory system, right? Oxygen's added by the respiratory system, nutrients is added by the digestive system, and then we feel it through our nervous system, right? And that tells us, hey, get up, go to the bathroom because your bladder is full. Then you have the urinary system, which actually filters the blood, pulls out the waste products, keeps things in balance like your electrolytes, and keeps everything moving, how it should be. So it goes into the kidneys to the glomerular, down into the ureter, down into the urethra, and out, or into your bladder, urethra, then out into the toilet. I don't have a diagram in front of me, so if I misspoke on that, sorry about that. So the urinary system is extremely important, okay? It's almost at that 15 mark. I don't have any fun facts of the day, but I can tell you it rained this morning in Bonita Springs, and it was beautiful. My plants needed it. I'm growing ginger root right now and have a whole lot of things that are just saying, feed me, water me, where is the sunlight? I'm sure everybody's feeling that right now. But that aside, the sun has come out and it is still 79, 80 degrees. However, this morning was really chilly. Okay, jumping into the endocrine system, right? So this one, again, it's my opinion, is the next system that if it breaks down, is a little less important. That's where we see the hormones or the regulation, dysregulation of hormones of the body's function, like growth hormone, helps with metabolism, reproduction. It includes all our glands like the pituitary and the thyroid and the adrenal glands, which then produce and release hormones into the bloodstream. Remember, the endocrine system also works with the central nervous system. Obviously, they work hand in hand, but you have like LH and FSH, and they go and they get the body to produce what they want to produce, which then helps with the reproductive system as well, right? So you have in tandem the brain and our organs working together. Everything works together. Don't forget that. But when we're talking about the endocrine system, right, you go to the endocrinologist, maybe you have, I don't know, Klinefelter's disease, which is an XXY chromosome or something that's going on that is changing the way your body produces reproductive hormones, whatever that may be. When we look at the endocrine system, we look at hormones. When we look at the nervous system, we look at neurotransmitters. Remember, neurotransmitters are quick, fast acting. They're here, then they're gone, right? Fight or flight, norepinephrine, epinephrine. Then you look more at the hormones. Hormones in the endocrine system are the slow acting, slow to build up, right? Slow to be used, and then slow to be gone. That's why you see like periods, right? You have menstruation, and the brain goes, yes, now it's time to produce blah, blah, blah. You're gonna ovulate. And then your body responds. But it's a slow and progressive, like feedback loop, they call that. So when you look at hormones and you look at the pituitary in your brain, right? The thyroid, the adrenal glands, and how they interact, the HPA axis, you're looking at more of a slow acting, slow response, slow to digest and get rid of, slow to move past, right? Hormones are slow, neurotransmitters are fast. Neurotransmitters do come out of our adrenal glands, right? Fight or flight. Hormones do come out of our adrenal glands, fight or flight. Neurotransmitters, brain, hormone signaling, brain. So we look at those things, but they have to travel through the body. They have certain targeted cells they go after that respond to them, sort of like insulin and blood glucose, right? So you have those things as well. But when we look at the endocrine system, we look more specifically at growth, metabolism, and reproduction. That's kind of the HPA axis. That's kind of just where we go and we look. Fun fact, pituitary gland is often referred to as the master gland because it controls other endocrine glands by releasing hormones that tell them what to do. Remember when the brain was talking to the body, that's what the pituitary gland is meant to do, right? So I don't have much more to say in the endocrine system. I work a lot with that, but again, it's all intertwined. All right, so integumentary system. Do you know what that means? I don't know why they just don't use skin. It is the skin. It is the tissue. I know it's because, there's certain layers. You got the subcutaneous, the cutaneous, right? So you have different layers and sublayers. So they call it a whole system and it works together and they have certain, but just call it the skin. All right, I'll be at my soapbox. Okay. The integumentary system protects our body from harm, regulates our temperature, provides sensory information. This includes our skin, our hair, our nails, and our sweat glands. See why they don't call it the skin? Come on. Anyways, yes, we have lots of glands. We have lots of hair that does different things. Our nails, right, to help us walk. The skin is the largest organ in the human body. People always think that and they're just like, oh my goodness, but how big is it really? It covers about 20 square feet. That's a super strong shield to keep us safe and help us to feel touch and temperature. So our skin has receptors on it. Our receptors go to our brain, typically via the nervous system, right? You ever see, like as a kid, you got to go, oh, don't touch the hot plate. And then you see the reaction. And anyways, when you do stuff like that, it's always quick acting. So it's going to be the nervous system involved, but it's involving our skin. It's involving the receptors on our fingers. Do you guys know what a homunculus is? So in the world of science, in the world of medicine, we talk about the homunculus. It's in the brain, and it basically gives each area of our body either a lot or a little area to feel or to have receptors to the brain. So like, for example, my fingers, because I do massage therapy, I touch things, my fingers and a lot of people's, we have more sensory. You can feel things more. It gets more area on the homunculus in the brain because it's going to be more sensitive to what's touching it, right? Your hands are typically very sensitive, right? That's just a good term. When you look at what's the least sensitive, usually the low back is what triggers. So when people say I have low back pain, really it can be in a lot of areas. There isn't much pain receptors or area on the homunculus that that the low back is sending signal to the brain. So just a fun fact there for you. Look up a homunculus. It's kind of funny when you look at the pictures, but it's really cool to learn about. Okay, after the skin system, the integumentary system, we look into the muscular system. Now, I usually just think like strength and weakness and all that stuff, but looking into the muscular system, you also look at basically the heating source, right? To help heat the body. The muscular system does help us move, maintain our posture, but it generates heat. It includes the muscles in our body, like the ones in our arms, legs, and our heart. So when we look at our arteries, they have smooth muscle. When we look at our heart, they have, I believe, smooth muscle. I'd have to look at the specifics on that. It's been a while since I looked at the heart and its tissue specifically. But when then you look at the bigger movers in our legs, you have the hamstrings and the quads, right? You have the tongue, which is a very strong muscle. All these muscles help produce heat. They keep us erect. If we don't use them, we become hunchbacks and then eventually hunched over in our 80s and 90s, can't even look up, which is really sad because we don't have to lose that. So if you're here and you need just a little pick me up, get out, start walking, really take on a gym membership, go with your friends, do things that get you active. Because when you're in your 40s, 50s, and 60s, if you don't, you're just going downhill. And I just entered my 40s, and just remember, we need to use our muscles or we lose them. We need to use our brain or we lose them. All these systems get weak because we either abuse them, like use them in the wrong way, or don't use them, which then they shut off and you get dead butt syndrome, right? There's certain things that you have to do in order to maintain your muscle. But maintaining your muscle is just as important as helping with edema, is keeping your posture straight, which then helps you actually get oxygen, which oxygen is one of the most important things we need. Our respiratory system is dependent on the strength of our diaphragm. Our diaphragm is a muscle. If we do not use it, we use it incorrectly, our breathing goes down. If our breathing is not transferring oxygen to carbon dioxide, what happens? I'm out of breath. I can't do this. Oh, it's horrible. You can't get oxygen to your tissue degrades, yada, yada, yada. You don't need a lecture, but it's pretty interesting. All the people that I see, I would say, myself included, we have to watch our strength, our flexibility, and our ability. How are we breathing? How are we sitting? How are we moving? Because if we're not moving, if we're not seated properly, and we stop using these, your body's not going to need them anymore. It just goes, hey, we're going to shut that off. Like when we sit all the time, it literally says, okay, well, your butt's going to disengage. And when your butt disengages, you get dead butt syndrome. Your body goes, I don't even know how to flex your butt anymore because you just don't use it. Well, what's one of the biggest muscles of your body? Your butt. What does your butt do? Helps maintain pelvic stability. Helps you stand upright. Helps you work if you had to work, walk. It even helps you sit. So think of those things as we start going through this, because it is very intriguing to me to see people who come in and even myself going to the gym. I mean, I went to the gym 3 times a week for 2 years, and I finally got my glutes to engage. And I have pretty good form. My trainers say I have good form. My friends are like, wow, you have really good form. But yet, my glutes were never getting sore. They were never activating the way they should. I was overcompensating because of how out of shape I got. So a little fun fact for you. Get out there and get your butt activated. Get your diaphragm working. It's not just the pelvic floor that gets weak, why you pee your pants or why you get weak. It is diaphragm. It is glutes, right? So you got to work on your muscular system. What is the strongest muscle of the body? All right, so I think I'm done talking about the muscular system. I was going to be like, oh, I'm going to talk about this, and then we'll come back to that. But the strongest muscle in the body is called the masseter. This is used to chew. It can exert a force of up to 200 pounds on the molars. So another reason to make sure your digestion is good is so you can absorb nutrients, because your teeth need nutrients to stay strong. Your bones need nutrients. They need the muscle pulling on the bone, the nutrients from absorption and pushing through the blood in the circulatory system to get there. And if you don't have that, or if you have genetic SNPs that go against that, then your bone absorption is going to decrease. You'll get osteopenia, then osteoporosis, and that's why in your 30s, 40s, and 50s, you really need to be eating properly, sleeping properly, looking at your genetics, moving properly. I'll get off the soapbox. What do you think the next system is? So we have done respiratory, circulatory, nervous, digestive, that's 4. Oh, maybe that's 5. Urinary, endocrine, integumentary, muscular, lymphatic. What is lymphatic? What is the lymphatic system? Lymph. Maybe it's your lymph nodes. Maybe it runs along with your nerves and arteries and veins in between your muscles and your skin in the fascia. Maybe all of those things. The lymphatic system helps defend the body against infections and maintains fluid balance. It includes your lymph nodes, your lymphatic vessels, the spleen, the thymus, and the tonsils. So a lot of times when you look at the lymph system, people intertwine the immune system, but they're a little bit different. The lymphatic system has no pump like the heart. It relies on the movement of our muscles to circulate the fluid. It's a hidden network of roads that keeps our body healthy. So the blood gets pumped around with our heart and gets returned over time and finds its way back through the veins, which don't have, I forget what kind of muscle. I'm going to have to look that up. It's bugging me. You guys should look that up and write it on the comments, or send me an email, info@ptbodytherapy.com if you need it. Okay, so when we look at the lymphatic system basically is a network that runs along those same areas. They're central to our armpits, right? Our neck, our head. They have a deep and a superficial system that's over basically our belly button, our torso. And then in our inguinal area, which if you can imagine right at the crease between the leg and the body that goes toward your pelvis, that is a big area as well. And a lot of times what happens is the lymph gets trapped down into our feet and our ankles and our legs, and when we sit, it pushes against the muscle, which then stops the flow of blood, but also the lymphatic system of returning to the heart. That's why at the beginning I talked about how we should get up and move every 15, 30, 45 minutes, which right now, get out of your seat. Go, do 5 jumping jacks. Run in place. All right, are you good? Are you back? Here we go. So when the lymphatic system gets stagnant by sitting, we can move, and the flexion and extension of our muscles, it flexes and pumps the lymphatic system to move around our body and to get where it needs to go. That carries a lot of our white blood cells, a lot of those things. The tonsils is, so when people get their tonsils taken out, like I got my tonsils taken out when I was 18, I had chronic infections. Well, the tonsils produce immunoglobulin A. Those are the first line of defense for our body. And having chronic infections you're taking away the line of defense. So if you want to have that conversation, let me know. But that's the first line of defense. The thymus and the spleen, they also have, I believe, one's the T cells and the B cells. And that really, really helps with our white blood cell. Oh, anybody tune in? You got it all for me? I'm shouting out my friend Tammy. Okay, Tammy, just write it. Maybe you need to come on my podcast right now. Then we look at all of the immune system and how it's working together, whether it's T1, T2, weighted, how that works, leukotrienes, all the things that start going and fighting infections. Those are very important, crucial things, and we'll talk about the immune system at the very end. So I want to get through this real quick. So a lot of people know about the skeletal system. It's the structure and support and protection for our body. So it includes the bones and the cartilage and the ligaments and the tendons. When you look at our ribs, that's going to help protect our thoracic cavity, right? Our organs. When you look at our pelvis, similar there. But our bones are an organ. They are being broken down and rebuilt, the osteoblasts and osteoclasts, with about 10% of our bone being replaced every year. The mass of our bone, about 10% of it gets replaced every year. So this is another SNP that sometimes drives osteoclastic activity or the breakdown of bone or the losing of bone, resorption of bone a little bit faster. That's why you can see certain families carry certain trends of having osteoporosis earlier in life. And lastly, before we jump in the immune system, is the reproductive system. The reproductive system is responsible for making babies, producing sex cells, sperm and eggs. It includes organs as the ovaries, the testes, the uterus, and the penis in males, right? So when we look at male, female, that's what we're talking about, reproductive systems. The sperm produced by man in his lifetime could stretch to the moon and back over 20 times. That's like having a super long, tiny road that helps create new life. That is hilarious. Okay, remember, I don't know if you guys know this, but women, when I have a baby, when women have babies and they are pregnant with a girl, that baby gets eggs, and those eggs are with her for her whole life, and that is what stays with her for her whole life. Those are the babies she'll have or not have, donate. Those are the eggs that she gets. She doesn't get any more. We don't get any more eggs. We hit puberty, those eggs come into maturation, and they begin. That's it. Men, their testicles produce sperm all the time, every day. It's a regeneration. So men, if you have a computer on your lap, if you're doing drugs, if you're exercising, taking testosterone, all these things affect in a positive or negative way their sperm for the next 24 to 72 hours. So I'm just telling you, guys have to be a little bit more careful to have healthy sperm than women do to have healthy eggs. Women have to have healthy bodies so that we can feed the babies. So if you yourself don't have enough folic acid or vitamins, once you do get pregnant, your body will then lose all of that nutrients, and that is where the baby gets it from. So the eggs aren't the issue. They're there. They're going to be there. It doesn't change. It's what we do with our bodies that can create the environment or not to help create a healthy body for the baby. Lastly, I want to talk briefly on the immune system. The immune system isn't considered an organ system, but it's considered a system that uses multiple organs. It protects the body against infections similar to the lymphatic system and diseases by identifying and responding to pathogens. Pathogens are bacteria and viruses, right? Certain funguses, etc. It includes many different cells, tissues, and organs that work together to keep us healthy. We listed a few of them in the lymphatic system. The immune system can remember past infections and mount on faster responses of the same pathogen if it's encountered again. It's like having a super smart security system that learns from past experiences to keep us safe. So we talked about SNPs a little bit. SNPs basically are little parts of an allele on a specific gene that allow us to see in research if they're not working properly or if they're heightened, can produce diseases. So that's just the little bits and pieces to that. But I know how much time I spend explaining these. And if you're interested in learning the SNPs behind each one of these organ systems, I did create and am continuing to expand my educational program with the memberships. They're included with the memberships with my private functional medicine clinic as well. So if you're interested in getting more into that, you definitely should reach out, or you can go online and look it up too. Different SNPs can affect different organ systems. No one organ system is going to work alone. They all work in tandem. We have a whole body. I just wanted to help break down each individual segment so that my listeners here, you guys can understand that from the beginning, when we talked about what's the most important in my opinion, all the way down to the least important, I do that based upon the body's ability to survive. Our body's job is to survive. If we are to survive and we have to limit things, our body's going to pick breathing over reproduction. Our body's going to pick circulation over reproduction. Our body's going to pick digestion over reproduction, right? You're seeing the trends. So if you look at, okay, let's say I'm in my 60s and I'm not concerned about reproduction anymore, but I'm in menopause and I'm still having hot flashes. And then, I don't know, I'm getting osteoporosis, or I've had osteoporosis for 5 years and I'm concerned about breaking a hip. Then you can go up the line. So that is our reproductive system, then our skeletal system. Now you're like, man, I'm getting sick all the time, because our lymphatic system, which is a lot of our immune system, that's breaking down. Oh, I can't even do the stairs anymore because my muscles give out. I'm not even strong enough to do that. Now I got brown spots on my skin. Oh no, like you keep going up the ladder. Now I'm incontinent because my urinary system, or my nerves, I just wet myself all the time. So you're starting to slip and lose a little bit on all these areas. Well, your body has to make sure you have oxygen first and activation. You have to be able to push your blood to the tissue that needs to get it, digest, and get nutrients into the blood to the areas. So your body is going to preserve what it can for the longest period as it can. When we look at the body as a whole, a lot of the reasons why people come into my clinic is because I can't get pregnant, I can't lose weight, I have dysregulation of my menses, right? I can't seem to have any effect on not peeing my pants. I have incontinence. The list goes on. The hot flashes. When I see patients, and you know who you are, in perimenopause and then go into menopause, when you get your period as a young person, the first time, okay, your body's shifting. But after 5 years of having your menstruation, it's supposed to be within 25 to 30 days, obviously, give or take, on the dot. You're not going to feel anything. You're not PMSing. You're not bloating. You don't have cramps. You're not having blood clots. And your period should be 3 to 7 days. It shouldn't be so heavy that you're using 12 cups. You got to stay home. That's not normal. And then when you get into perimenopause, right, your body slowly just goes, okay, well, I'm going to skip a period. But you shouldn't have hot flashes. You shouldn't have night sweats. Your libido should stay the same. Your memory shouldn't be wiped. Your blood flow should stay the same. It's just going to skip a period because your egg is going to slowly just not release, because that's the natural progression. When you go into menopause, you're not supposed to have any symptoms. You just stop having your period and you're done. Then all of a sudden a year goes by and you still haven't had your period, but you're not supposed to have libido issues, dryness, all of those symptoms. That's not normal. If these things are happening, it's because something up the line in the other areas of your health are degrading, and they've been degrading maybe for years or decades. That's where I do my best work in helping patients like you go, what's happening? Let's find the real reason. And some people call it root cause, and some people, right? I don't care what you call it. But that's why I'm doing these educational podcasts and this educational program is there's a dire need to learn about what does a healthy body do? If I'm not healthy, then how can I get healthy? It is possible to not have these symptoms. It's supposed to be not having these symptoms. But which part of my system is not working, and how can I support it without going on these extreme diets or getting bioidentical hormones? Which is it? So those are the questions I pose to you to think about. What am I doing for my health? What's good? What's bad? What needs help? What kind of doctor do I need to go to? What organ system is failing? Why is it failing? What SNPs are involved? These are the areas where I really help patients, you, understand the differences, the nuances, how to help your body in little effective ways that change your life. And I see it patient after patient after patient. But the challenge is, how bad do you want to see the change? And what are you willing to do as a lifestyle? Unfortunately, I see a lot of people after they go the bioidentical hormone way. I need to get better at educating patients and getting in front of patients quicker so that you guys know there's other ways besides just putting gas on the fire. When your hormones are not at the right ratios, your body has symptoms. Well, how can we help your body produce hormones at the right ratios? Well, you support the body so that each system is supported down the line, and then your hormones start coming into line as well. I've seen it time and time again. Patients come in with HRT, and we say, hey, this is your problem, we support the problem, and then over time their levels start leveling out and they have to start getting off their estrogens, they have to start getting off their progesterone because their body is actually normalizing it. Testosterone comes back online. We just have to make the change, put the discipline in, and that's where I say, hey, I'm going to challenge you. Do you really want to get better? That's a common question in my clinic. Do you want to get better? It's a simple question, but a lot of people don't know that there is a better, that there is a better forever, and that you can do it with specific ways instead of having to uproot your whole life. So today, I want you to forward this podcast, like this podcast, and really think about the things we talked about. And if you didn't cover and sit and listen to all this, well, I don't know what to tell you, but I would encourage you to come back and listen. So I'm just going to say, signing out, this is Dr. Nicole. I hope you have an amazing rest of your day, and I hope you share this with anybody who needs the information. Take care. Bye-bye.